Sciatica can be a real pain in the butt. But what if I told you that pain in the butt could actually be coming from your low back? Let me explain. Rehab. Welcome back to the channel. Dr. Adelle here, and today let's talk about all things sciatica. This is a term we hear frequently, and maybe it's a term you've heard yourself or something that you're experiencing with and dealing with. So let's first discuss what sciatica is and then get into some exercises to help. Sciatica comes from the Greek word ischiadikos, which means pain in the hip, which is quite literally what many individuals feel when they're dealing with symptoms from sciatica. Some individuals may get symptoms down their leg, with these symptoms typically following the route of the sciatic nerve, which is a very large nerve, the largest nerve in the body, in fact, that originates from the lumbar spine and sacral region and runs the length of the back of your leg, breaking off into different branches all the way down into your foot. Key part here being is that the nerve originates from the lumbar spine and your sacrum. With that being said, sciatica-based symptoms are more often than not a result of irritation not just of the nerve at the hip, but actually from your L4 to S3 nerve roots, as this is the origin of your sciatic nerve. This irritation of the nerve roots can be caused from compression, overload, or even trauma sometimes of the nerve roots where they originate from the lumbar and sacral areas. If we know anything about nerves, it's that they love movement, blood flow, space, so generally, sciatica responds really great to conservative care and exercise. So yes, while you may feel most of your discomfort in your gluteal region or even going down the back of your leg, oftentimes that particular spot that is painful is not necessarily the root cause of your pain and discomfort, and symptoms are likely originating from your low back instead. So how do we address this? Let's find out. First up, mobility. When dealing with low back discomfort or sciatic type symptoms, it's important to meet our body where it's at to begin with and explore what feels comfortable. The last thing we want to do is drastically overload or irritate the nerve further, so listening to your body and respecting its boundaries as you start to integrate movement is key. Let's start with the supine pelvic tilt. This exercise allows us to use gentle movement from our pelvis to increase mobility and decrease sensitivity with lumbar extension and lumbar flexion. You'll notice when I get into a posterior pelvic tilt, my low back naturally rounds. And as I get into an anterior pelvic tilt, my spine naturally arches or extends. This in turn starts to increase blood flow, decrease muscle guarding, and calms down our nervous system without excessive use of surrounding muscles. When dealing with acute onset of low back pain, find what feels most comfortable for you and play into that while respecting what position doesn't feel as comfortable. You may notice that this can vary day by day, and that is totally okay. Perhaps pelvic tilts feel good laying on your back, and one day they might feel better when you're sitting up in a chair. And who knows, maybe you'll even feel comfortable to throw some lower trunk rotations in there too. The key here is that we are continuing to move and the pain-free range of motion will continue to improve. Next up, let's address hip mobility. If you remember, the sciatic nerve is pretty freaking big and runs underneath a bunch of structures in our hip, including ligaments, muscles, tendons, so ensuring you have adequate flexion, extension, and rotation of the hip will allow that nerve to move a little bit more fluidly through all those nooks and crannies with your day-to-day tasks. Along with addressing mobility through our low back and hips, we also want to work on mobility of our nerves. That's right, just like how our joints and muscles crave mobility, our nerves crave mobility too. I've said it before and I'll say it again. Nerves love three things: movement, blood flow, and space. So let's work on giving that sciatic nerve exactly what it wants. As mentioned, that sciatic nerve originates in our lower lumbar spine and sacral region and runs the length of our posterior leg. In order to get that nerve moving, we want to perform a sciatic nerve slider and eventually progress to a tensioner. When working on nerve mobility, you always want to begin with a slider. If we can imagine the nerve as a piece of floss running down the length of the back of my leg, we want to move the nerve through the tissue without placing tension on the nerve. This is where the slider comes into play. We tension it on one end while slackening it on the other. For example, when I straighten my leg and point my toe, I'm slackening the nerve while I tension it by rounding and slumping at my spine, simply allowing the nerve to glide through the tissue without providing an excessive level of tension to the nerve from both ends. The tensioner, on the other hand, we are progressing to more tension by tensioning the nerve root from both ends. At the end of the motion here, you see me pull my toes up towards me while maintaining the slouched position. This is going to provide tension to the sciatic nerve, and many individuals may feel a deep stretch through the back of their knee or into their calf or foot, depending on the neural tension they present with. Now that we understand just how important mobility is, it is time to start thinking about how to strengthen the muscles that support our lumbopelvic region and hips to ensure long-lasting results and hopefully prevent this from happening again. There really is no gold standard when it comes to strengthening exercises for sciatica and low back pain that works for everyone. More so, a comprehensive program that includes a little bit of core, paraspinal, hips, and maybe even pelvic floor exercises is what's really going to help. The key is to progressively load your tissues to withstand the demands of your day-to-day life. That means starting with basic core exercises and progressing them. That means starting with simple hip exercises and progressing them. That means starting with easy back strengthening exercises and progressing them. That's where our low back rehab and prehab programs come into play. Both of these programs progressively teach your spine and hips to withstand the normal loads we expose our bodies to day in and day out, to avoid that excessive strain on your nerve roots and therefore your sciatic nerve. Okay, prehab fam, so let's recap. We are going to start working on back mobility. We are going to start working on hip mobility. We are going to start working on nerve mobility. And last but not least, we are going to work on progressive strengthening. We know nerve pain can be really scary, but remember, sciatica is most often treatable with the right exercises and a comprehensive plan in place. So take some deep breaths, give these exercises a try, and maybe we'll see you on the app for more. See you next time, prehabbers. Hey prehabbers, if you enjoyed our content, go ahead, like and subscribe.
Or better yet, head over to our website in the description below and check out the dozens of programs that we've created to help you take control of your health today.